Hi, I'm Stephen Ferrara. I'm the Executive Director of the Nurse Practitioner Association, New York State. And today I have two guests who are practice owners in New York State, and I'm going to introduce you to them. We have Dr. Brighid Gannon, nurse practitioner, and we have Dr. Pritma Dhillon-Chattha, an RN DNP. Brighid and Pritma are co-founders of Lavender, an online psychiatry and therapy office that modernizes mental health care and improves the patient experience. So thank you both for being here today.
Thank you for having us.
Thanks for having us.
Thanks. And so Brighid, why don't we start? Can you just give a little background about your pathway education experience and how you got here today?
Yeah, sure. So I actually, before I became a nurse, I studied dance at Wesleyan University, and I graduated in 2008, right at the economic downturn. And I was kind of trying to dance professionally, but that industry was kind of dying. And to be honest, I really wasn't good enough. So I was exploring all different careers. And I really was very interested in the mind-body connection from dance. And I also wanted to be at service to people. And I discovered nursing, which was the best decision of my life. So I went to NYU to get an accelerated bachelor's degree. I worked in women's health as an RN very briefly, and then I decided I would become a psych NP and went to Penn. So after I graduated with my psych NP, I worked at a large women's shelter in Brooklyn, New York for women with chronic mental illness. And I always had a side gig of doing psychiatric consultation in nursing homes. I also have another business called IV Psychiatry, which is a group of about 14 psychiatric nurse practitioners that provides consultation services to nursing homes all throughout the state. And then, you know, I felt like I was missing some skills, like in regards to leadership and education and research. And that's why I went back to get my DNP, where I met Pritma at Yale.
Thank you. And Pritma?
Yeah, so my background has been pretty varied as a nurse as well. I've been nursing now for 18 years. I did my nursing at Seattle Pacific University and started off in hospitals, and then eventually that led me into leadership, and I've had the privilege of working in a lot of different settings. I've been in occupational health, working for the airline industry. I've been in consulting in oil and gas. Most recently, I was the provincial director of electronic quality and safety for Alberta Health Services, which is the largest health system in Canada. Actually, I'm based in Canada, although I have this business in New York. So yeah, my experience is quite varied. I'm in informatics right now, so clinical informatics. And what led me into nursing, I guess, was really my mom. My mom was a nurse. They were new immigrants to Canada, and you know, we moved around a lot growing up because of the job search and the economy at the time. And I remember from growing up that whenever we moved, my mom always got a job really quickly and was kind of that stable source of income throughout my childhood and growing up. And so that really made me gravitate towards nursing as a profession. And I was also always kind of seen as the caregiver within the family. I have very young siblings and a big family, and I was always the one that was taking care of them. So it was a bit of a natural fit, and I really had no idea all of the opportunities that existed in nursing beyond the bedside. I mean, the bedside is definitely the place I recommend most nurses start at because it gives you such invaluable experience, and many choose to stay there, and it's so rewarding. But I had no idea what my career would lead me to, and so today I have many hats. I wear the clinical informatics hat. In my partnership with Brighid and Lavender, I do a lot of the tech and the business side of things. I own a cosmetic injectable practice as well. And I have another startup. I started up an app, which I recently just sold to a company based in New York as well. So I've been juggling a lot of different things, but it's made a good complement of a full-time job, and it's allowed me to really focus on the things that I'm passionate about.
That's excellent. Thank you. And I think, you know, what I'm fascinated about with Lavender, and we'll get into that, is it's, you know, mixes traditional, you know, patient care, but with the tech side to modernize it for today's busy patient. So with that, why don't we, my question is, where did this idea come from to start Lavender? Whoever wants to start that.
Yeah, I mean, so we, you know, you can imagine in New York, especially in March and April, people were really, their mental health was really struggling because of the quarantine and all of the fear around COVID. And Pritma and I were both getting constant calls from colleagues, from nurse colleagues, from friends, from family, asking for mental health referrals. And kind of the story we kept hearing was that it's in, you know, people are not responding to me via email. Nobody has their phone numbers listed online. Their practices are full. They're not doing online appointments yet, or there's no price transparency on their website. So I don't even know if I can afford this. They don't take health insurance. And if they are transparent with their pricing, it's extremely expensive. So we realized that there was a real accessibility issue with mental health services in New York, and that Pritma had the idea. She said, let's start an online psychiatry and therapy business now, when people really need it. And so we launched Lavender from idea to implementation in 45 days.
Wow.
Yeah.
That's impressive.
We really felt like the need was incredibly time sensitive and people really needed help now. Yeah.
Yeah, and to add to that, we realized that we had kind of the people, the know-how and the resources, right? So Brighid and I make a really good pair, I think, because she brings obviously the clinical expertise and I bring more of the tech and business expertise. So it was a really good match, and we were able to mobilize resources quite quickly because of our other experiences and businesses. So it worked out really well. It was like magic.
Yeah.
I'm sure I was super quick too, and like a whirlwind.
Yeah, it was a lot of work.
So explain to me how some of the first steps that you took. So you have this idea, you have this concept. How do you bring it from concept to actualization?
Do you want me to take that, or you want to take that, Brighid?
You were flying the plane for this part. I was co-pilot.
Oh, I think it was pretty, we kept switching. Well, you know, the first thing is we needed a PC, and Brighid was smart enough to, when she incorporated about a year or whenever ago it was for Ivy, she's like, you know, it takes so long in New York to create a PC. I'm just going to create two, just in case one comes in handy. And so that was huge for us. And Brighid, how long does it take to go through that process otherwise?
The last time it took 4 months. Yeah. So I was just like, what if I have another business idea? I don't want to wait 4 months. So I was like, and I just actually applied for another PC for similar reasons. I was like, Pritma and I just need a lot of PCs. Yeah.
Yeah. You never know when the mood strikes, hey?
Yeah.
So that was a savior, where she's like, well, I have this PC sitting here, and we thought, great, okay. So for those that don't know what a PC is, it's a professional corporation, and so she already had that, and we're like, great, that's one thing done. And then we had a brainstorming session, probably about 3-4 hours, and we thought, okay, what are the things that we quickly need to do? And we just kind of punted out our task list of, okay, well, we need to find an EHR that's HIPAA compliant and also has telehealth. So we looked at all of the various EHRs, scheduled demos, did all of that. Brighid started on the clinical guidelines and the clinician handbook. I looked at the website pieces and the marketing pieces. So it was basically a lot of work in front of the computer for many hours over many weeks to get things going. The other big component of our success in launching it so quickly was also the manpower. So Brighid already has IV psychiatry, and we were able to redeploy some of those nurse practitioners onto Lavender during hours that they weren't otherwise working, right? And especially during quarantine. there were many ways, so they could do telemedicine from home. So I think those two combinations were really perfect in terms of having the manpower, the PC already there, and then everything else was just a lot of hustle in a short period of time in terms of what we needed. So yeah, Bridget, I don't know if you want to add anything to
Yeah,
that.
and there were some basic things, you know, we needed a name, we needed a logo. So, you know, Pritma and I, you know, we did some brainstorming about the name. She came up with Lavender, which we went back and forth about, but I'm so happy we ended up choosing it. And we, you know, we knew that we had to act quickly, so we tried not to get too obsessed with making the right decision. We knew it was more important that we launch and we test, so that we could pivot the business based on customer and client needs and preferences. Yeah. Yeah.
Yeah, that's great. Bridget, can you talk a little bit about that PC process? You know, did you do it on your own? Did you hire an attorney to help you with that?
Sure. Yeah. So in New York State, you know, if you are a professional providing professional services, you can only do that under a professional corporation or a professional LLC. I think it's the most stringent of states in terms of the corporate doctrine of medicine law. And I just use a company called USA Corp to incorporate my PCs. I think you can hire a lawyer. I think some accountants can do it, and you can probably also do it yourself, but I've had really good experience with them. Yeah.
That's great. Thanks for that resource. I'm sure a lot of people will be interested.
Yeah.
It's sort of like square one, how do you start this process? So that's
Yeah,
great.
and it does take 3 to 4 months. And I would say for any NPs out there who are just even thinking about someday having a business, just form a corporation so it's ready for you. Because waiting 3 to 4 months is a long time to start business. Yeah. Set it up,
Sure.
link it to a bank account, and it can sit there until you're ready to use it. Yeah.
Right.
And I think also to add to that, not only if you're starting a business, but you know, that would come in handy anyways. So say you don't follow through on a business idea, but say tomorrow you start to work for a company that wants to do 1099 with you or something like that,
Yeah.
right? Where you're contracting or picking up extra hours with another telemedicine company or with nursing homes or other companies. It's very helpful from a tax perspective, I think, too.
Yeah, absolutely.
Definitely. Did you file a doing business as for, you know, the name Lavender and the PCs under your own like license as a nurse practitioner?
Yeah, so we filed the DBA. That was another thing we had to do. We had to get a business credit card. We had to get malpractice insurance. I mean, there was a long list of things that we did in about a week.
Mm-hmm.
But yes, we did file a DBA. That is
Right.
you can pay a little extra money to have that done within 72 hours.
Great.
Yeah. So that's
good to know.
less of a time-consuming task. Yeah.
Sure. And what were some of your earliest challenges you had as you were getting this off the ground?
I think some of our earlier challenges obviously is getting patients through the door. And to do that, we were exploring insurance. And so how do we accept insurance to make this more accessible? And that was, I think, a difficult process. We met with a lot of billers. Maybe you're the better person to talk about this.
It was so funny talking about insurance in America with Pritma, because I would say things to her and I could tell that she thought they sounded so ridiculous that I had the information wrong or something. And I would think in my head, no, this is how America works. You know? So I mean, I'm sure a lot of NPs can relate to this, but we met with so many billers. Mostly we just wanted the rates. How much do we expect to get paid from the big private insurers? And that information, nobody is transparent about that information. And, you know, until you have that information, you don't even know if it's worth credentialing, because you don't even know if you can survive financially based on what you're paying your staff. And I think we still really never got answers on that super clearly. Billers will give you estimates, but they're not super transparent with that info at all. Yeah.
And then the other problem I think we faced with insurance was that our model for our providers, so we have a lot of psychiatric nurse practitioners working for us, but it's kind of an Uber model where they add their availability as needed, they can remove it as they need to, and they're only getting paid based on the appointments that they see. And so at any given time, we might have an NP join or leave or what have you. I mean, we're pretty steady at this point, but at the beginning we thought, well, what if we have people joining and leaving, and it's costly to credential a provider with one insurance company, let alone multiple. So how do we support that cost and yet provide accessibility to patients? So that was a really difficult, it was a very difficult process, and we still didn't, then eventually we found a company called Headway, and they're absolutely amazing. Our first appointment, our first session, our first meeting with Headway, they told us about their platform. They're kind of an IT company / billing company. So they're modernizing insurance billing for providers and allowing providers to kind of bill through them as a bit of a subcontractor. And so when we first met with them, we just couldn't understand. They actually did provide price transparency. They're like, yep, you're going to get paid this amount for this initial visit with this company. And we're like, okay, what's the cost associated with that? How do we credential? And they're like, no, there's no cost. You're just gonna. And so the answer to our prayers kind of was through Headway, and it worked out really well. And I guess this is a bit of a plug for them, but they worked out really well. And so for anyone that does have a private practice and is looking to take on insurance providers, definitely look into them. And I think there's other companies like that, but they're very new, and they're kind of modernizing the billing space as well. And they make it really relatively easy for the provider.
There were angels to find, and it felt so good for us to be able to take insurance too, because that was in line with our accessibility mission. That was always what Prim and I were always struggling with. We started Lavender because we wanted to increase accessibility, and one of the best ways to do that is to take insurance, because so many psychiatrists and therapists and psych NPs are not able to take insurance in private practice because it's so much administrative burden for one individual practitioner, so it's been great to take insurance, and we hear from people all the time how grateful they are that they found a psych NP that will take their United and Oscar and Oxford, Yeah,
that's amazing. I know that's one of the biggest challenges I hear from patients as well. It's number one, access, and number two is a provider that actually takes insurance. So I think that's a fantastic model that you've been able to work out, and your patients are quite lucky to have found that. So we talked about challenges. Now, how about some early successes? What have been some of your early successes? There's got to be some.
No. There's lots. There's lots. I mean, definitely we're blessed to have the providers that we have. I think first and foremost, we have some amazing nurse practitioners. They stepped up and they have been seeing patients and doing a fantastic job, and we call them our founding NPs because they're building this company with us and supporting us every step of the way, providing us with feedback on process improvement and really collaborating within the process to ensure that our patients have the best experience. So definitely them. The ability to take insurance was another success. And then we're seeing a lot of I think for me personally, because I answer a lot of the calls, actually, I end up answering, as a startup, we end up doing everything. And it's just been really, really rewarding to see that we are helping people. And, people are so happy that we actually just answer the phone, and there's a human on the other line, and we're happy to help. And even when we can't accept them as a patient because we don't take their insurance or something else, we point them in the right direction to other resources that can. And they are so grateful for this, for just taking that pause to provide them that information, because they're truly struggling. And so it's been really rewarding for me to see that, and to be able to really connect with these people and support them, whether they do become a patient or not.
Yeah.
Brighid, I'll pass it on to you.
Yeah, I mean, absolutely. it's people are shocked that we pick up the phone, that we respond to them via email, that they can get an appointment within 48 hours. All of those things are really making their experience of accessing mental health care more kind and compassionate, which, really should be kind of like the status quo, because when you're struggling, it's such a shame that in accessing mental health services that experience is sort of more re-traumatizing to you. Pritma and I we finally got a chance to breathe and look at the numbers, and we've had like a 400% growth in 4 weeks, right?
Yeah, so month over month, we're seeing about a 400% growth month over month.
Yeah, so that's a huge success.
Yes, sure is.
We're not seeing that letting down, really. We're anticipating that going forward for several months, and then maybe it will ebb off a little bit, but we're still in a very exponential kind of growth phase as we start picking up more insurance and partnerships and things like that.
Yeah.
That's great. And are you only offering services in New York State?
Currently.
Okay. And
yeah.
So providers anybody in New York State could theoretically refer to you, and your platform is virtual, so it really is not dependent upon physical location. And I know that you have a very specific number of conditions that you treat, and you make it clear of what you do treat and what you don't treat, and what you prescribe and what you won't prescribe. Can you talk a little bit about that and how that you're thinking into that process?
Yeah, we're actually going to update that list. So when we first launched this, we really wanted to be very careful about which conditions we treated in terms of what the online experience would be like for patients. But we've actually found that our providers are capable of treating a lot more than the conditions we're listing. So we are going to update that list. For example, Pritma had this great idea of doing collaborative rounding with therapists. Where we do an initial hour intake with a patient that's referred from a therapist who knows that patient very well. And then after our initial intake, we join the therapy appointment virtually for 20 minutes. And in those situations, we are able to manage more complex mental health conditions like bipolar disorder or anorexia or chronic PTSD. And the reason that we sort of came up with that solution is because we are getting calls from people that need help, and we want to, we're nurses, we want to help people, we want to find a way to service clients that have more complex conditions that need high quality care. Yeah.
Yeah, because those are the clients that are actually falling through the cracks, we're finding, right?
Yeah.
So
Sure.
We're really trying to pivot to the needs of our clientele, and we're really closely monitoring the needs of the callers and the people that are inquiring about services. And so we found that there was a significant gap. We were having to say no to a lot of people. So we put our heads together to say, okay, how can we troubleshoot this and figure it out, and again, provide accessibility with the limitations that we have of telepsychiatry. And so the collaborative rounding program was a good success. The seniors mental health program was something that we didn't anticipate at all, but again, connected with a family nurse practitioner, and he said, look, I'm having so much trouble getting psychiatric care for my patients. He does house calls with them, and it's cost prohibitive, and there's no psychiatrist wanting to go out, nor are they doing telepsych. So we quickly put our heads together and said, okay, how can we make this work? And we did. And so because of the referral partnership with him and corroboration of medical history, we're able to support these clients within their home where they're the safest because they're the most vulnerable, and provide telepsychiatry services.
That's great.
And we take their Medicare, which families are always happy to see. Yeah.
Totally. And so how do providers refer to you, and how can people find out more information?
Yeah, so providers can contact us directly. If they're looking to speak to Brighid or myself directly, they can email us at founders@joinlavender.com. That's our direct email. For patients, if they're wanting to direct patients to us, they can email us at hello@joinlavender.com, or they can go to our website, www.joinlavender.com. We're happy to send out some brochures, some pamphlets, or business cards, things like that, that they can have in office, or if they need to pass them along electronically, we can do that. We like to, with other providers, whether they be family nurse practitioners or therapists or whomever, we do like to set up initial calls with them. So, you know, it's always good to understand a little bit more about their practice, what their needs are, what their niches are, and for us to share a little bit more about us, because not everyone, you know, we want to make sure that we have a good working relationship with them. So we've been doing a lot of Zoom calls with our colleagues, and then that further kind of supports the relationship going forward.
Yeah.
That's great. Well, thank you both for taking the time to answer these questions. Do you have anything else that you'd like to add?
No, this was a really great combo. It was like, helped me reflect on our experience so far. We haven't really had time to do that, Pritma and I. We've just been working nonstop.
I'm sure it's been very, you're managing a lot yourselves. And how are you managing that? I guess that's my question to you. I'm turning the tables. So how have you been trying to balance? I mean, you're both very busy. You are juggling more than one practice and roles. How are you doing in those managing that?
I mean, I meditate every day.
Okay.
That's the first thing I do before I have a cup of coffee. I meditate for 20 minutes. I do a form of meditation called transcendental meditation that I highly recommend to people. Yeah.
Great.
Yeah.
Great.
With regards to myself, yeah, it's been chaos, and I have a 3-year-old. I have a 3-year-old and a 6-month-old at home as well. So it's getting, you know, delegating. You know, I have a nanny. It's delegating and letting go of some things. So if the house is a mess, it's going to be a mess. If, you know, little things aren't done, they're not going to be done. And then also taking the weekends for myself. I try to totally turn off on the weekends, as well as between 4 and 7 p.m. I turn off and I spend time with the kids until I put them to bed. So really just making sure that you have time in your day and in your week for some joy and downtime, I think is super important. Yeah, and then I guess the last thing I'd want to add is for anyone out there, for nurse practitioners looking to go into business or take a new step in their career, whether it be a business or not, whether it be that next step in their career into a different role that's going to be challenging for them, you know, take the risk and take the leap, and you know, I think act is what we can do. And oftentimes as nurses, we think, but then we don't act on some of those impulses. So I would urge everyone to act and take the leap. And if you need a boost of confidence, you know, reach out. Even if you don't want to refer patients to us, you don't have to. Like Brighid and I love to mentor fellow nurses and colleagues. And so if anyone's looking for any advice, we're always happy to help. You know, just be patient with us. We might take some time to respond, but we will respond. And we're always looking to help and support and lift up our fellow nurses out there.
Yeah.
That's fantastic. Such an inspiring story. I feel like, you know, we can have to schedule another session to go on, you know, to answer more questions that I have that I thought of as we were talking here. But I want to thank you both for being here today. I also want to put in a plug, of course, for the Nurse Practitioner Association, which you both support. And you know, this is why we do this. We're trying to reduce practice barriers so individuals like yourselves can practice, can open up things that there's no reason we shouldn't be able to. So thank you both for supporting the association. And, you know, we look forward to checking in with you again. And it sounds like you also have other things cooking, and I definitely want to hear about that too once you get those off the ground. So thank you again, and we'll hear from you again soon.